Today, we're going to be talking about a medication that is very common in the rheumatology world, but not so common in dry eye treatment and not something you would normally expect to hear about from your optometrist. Today, we are talking about Acthar Injections. So Acthar is a new, old anti-inflammatory medication, and it does have ophthalmic and optometric applications that are actually really exciting for dry eye patients suffering from severely inflamed eyes. So these are your more severe cases. In recent years, there have been numerous new medications evaluated for ocular inflammation. We have new things coming out all the time, but Acthar, that might be much more accessible than something new, though some might think it controversial, there have been big breakthroughs for dry eye treatment with this medication. So welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so that you can have healthy, beautiful, comfortable eyes. Give a little love tap on the subscribe button down below before you leave to stay up to date with all the latest eye tips and tricks I have for you. I do make videos every single week related to dry eye and ocular aesthetics. So what is Acthar? Well, Acthar is repository corticotropin injection, or RCI, also known as Acthar Gel. It's an adrenocorticotropic hormone, or ACTH, that is thought to quell inflammation by stimulating the body's own ability to produce endogenous steroids, so steroids made by your own body, as well as affecting steroid-independent immunomodulatory and anti-inflammatory pathways by binding the melanocorticotropin receptors. Now, these receptors are found on a range of your immune cells, your T helpers, your Treg cells, or regulatory, your dendritic cells, macrophages, as well as on retinal pigment cells. Like most hormones, the original form of ACTH had a half-life of only about 10 minutes, so Acthar was actually developed for clinical use by creating a repository gel. This gel can be injected intramuscularly or subcutaneously and tailored according to the needs of the patient in terms of dosage. So you are hearing that right. This is not an eye drop. This is an injected medication. Now, Acthar has been used most commonly in MS, infantile spasm, nephrology, and rheumatology, but there's been a recent study with a number of patients with uveitis that had not responded to previous attempts at treatment, most often with steroids, and when Acthar was initiated, they showed significant improvement. The same with a severe dry eye disease study showing improvement in clinical signs of dry eye over a 12-week period, both in corneal and conjunctival staining. So few drugs show this level of efficacy on quality of life when you look at questionnaires like the IDEAL questionnaire. That's one often used by companies like Alcon to see what kind of an impact medications have on patients' quality of life. So why would Acthar be controversial? Well, it has made the news. It was the subject of a 60 Minutes story actually on rising drug prices. And of course, we know that rising drug prices are a serious issue that face our country and our patients. In Acthar's case, it was first introduced to medicine in 1952. It had approval at that time to treat all steroid-responsive conditions. Acthar is an orphan drug. So an orphan drug is a pharmaceutical that remains commercially undeveloped owing to perceived limited potential for profitability. The drug was discontinued until pediatric neurologists who felt Acthar was essential for the treatment of infantile spasms appealed strongly to the FDA for a label and cost review in order to ensure its continued availability for their patients. Since acquiring Acthar, the company that has it is Mallinckrodt, they've made price adjustments, hopefully making the medication more available to patients. So let's talk about how Acthar works. It's used for the treatment of severe acute and chronic allergic and inflammatory processes involving the eye and adnexa, so keratitis, iritis, iridocyclitis, diffuse posterior uveitis, choroiditis, and optic neuritis. It can also be used for anterior segment inflammation like we see in dry eye. It contains ACTH, or adrenocorticotropic hormone, which stimulates your body to produce more natural steroid hormones so that you can reduce or eliminate the need for additional steroids or other immunosuppressants like methotrexate or cyclosporin. It has an anti-inflammatory effect because it uniquely binds to a specific receptor, that's the melanocortin, to help downregulate both inflammation and the signals that keep inflammation going once it gets started. These receptors are found on 5 different types of immune modulating cells throughout throughout the body, including the T helper cells and the T regulatory cells, as well as the macrophages and dendritic cells. So what is Acthar injection for the eyes? First of all, it's not put in the eyes. It's an in-home injection, so it'd be similar to taking like insulin treatments, except Acthar is once or twice a week as needed. And it has been approved to treat severe and chronic inflammatory processes of the eye and its adnexa, including dry eye disease. So where is it injected? Not the eye, right? It's beneath the skin or into the muscle, most commonly, and actually the tummy. Commonly reported side effects of Acthar: you can have injection site reaction, you can have fatigue, physical weakness, lack of energy, you can retain a bit more fluid, have insomnia, not unlike a steroid, you can have a headache or blood sugar issues. You should not take Acthar if you have a number of different conditions. So if you're receiving a live or live attenuated vaccine, if you have a skin condition called scleroderma, if you have bone density loss or osteoporosis, if you have any active infections like fungal, bacterial, or viral eye infections like ocular herpes simplex, if you've had recent surgeries, stomach ulcers, or a history of those, if you have heart failure, uncontrolled high blood pressure, Addison's disease, Cushing's syndrome. So make sure to tell your doctor about any health problems you have or being evaluated for, and make sure you give a complete list of medications you're taking, because it's really, really important that we don't put Acthar on board in certain cases. We want to know all of your herbal supplements, all of your medications you're taking. So you should never inject Acthar directly into a vein. And my experience has been with this medication that when it is prescribed to you by your doctor, the company actually has great nurses that reach out and call you, since you will be responsible for taking the medication yourself. Now, there are some offices where they have a nurse on board and they can give you the medication right there in their office, but I know that when I prescribe it, my patients are actually responsible for taking the medication themselves. As with any medication, if you have difficulty with it, if there's anything that pops up that's new in terms of symptoms, you should absolutely tell your doctor. If you have adverse effects or any signs of infection or anything like that, if there's fever, headache, you definitely want to report all of those secondary side effects that we talked about. When taking Acthar long term, your adrenal gland may produce too much of a hormone called cortisol. This can result in symptoms of Cushing's syndrome. So we talked about Cushing's syndrome being something we want to avoid this medication with. Well, it can actually cause it as well. It can cause Cushing's. This can cause increased upper body fat, a rounded moon face, bruising easily, muscle weakness. Sometimes when you stop taking Acthar long term, your body may not produce enough natural cortisol, and this is called adrenal insufficiency. In that case, you might have to be prescribed a steroid medicine that protects you until the adrenal gland recovers. You can also develop high blood pressure, retain too much salt and water, or have low blood potassium levels. And as a result of this, your doctor might recommend changes to your diet, like eating less salt or certain supplements. It just depends kind of on what happens. The other thing is that vaccines may not work well when you're on Acthar, so you have to talk to your doctor about which vaccines are safe to use when you're taking Acthar. Acthar can also hide symptoms of other diseases, making it more difficult for your doctor to make a diagnosis. So if it's helping with system-wide inflammation, it can reduce symptoms of other things that might be going on. It can also increase risk of bleeding and stomach ulcers, so you have to definitely let your doctor know if you have any symptoms of stomach pains, bloody vomit, excessive tiredness, increased thirst, difficulty breathing, increased heart rate, and those sorts of things. This is sounding awful, but I promise it's not this awful. Usually, I've never seen it be this awful. This is just things we have to tell you. It can also give you mood swings, trouble sleeping. Those things are reversible if it's stopped. So, gosh, this list goes on and on. Diabetes, muscle weakness, certain eye conditions, cataracts, glaucoma, optic nerve damage. Your body may develop allergies to Acthar. These allergies may be severe. Signs of allergic reaction include skin rash, itching, swelling of the face, tongue, lips, or throat, trouble breathing. The effects of Acthar may be intensified if you have an underactive thyroid or cirrhosis of the liver. So here's the thing, this is all with long-term Acthar, right? So I have to include all of this stuff because I'm making YouTube videos about it, so I'm pulling a lot of this from the drug information itself and making sure that I tell you guys everything about it. Here's the real deal. In terms of treating dry eye disease, I'm usually not putting Acthar on board until somebody has tried IPL, has tried topical steroids, has tried those immunosuppressive suppressants like cyclosporin and Xiidra and Cequa. So I'm not using this until later on in the treatment, and oftentimes when there's rheumatology on board as well, we have other autoimmune diseases going on. And so these are very, very specific cases, and I'm talking with the rheumatologist and the primary care and letting them know exactly what we're doing with Acthar. If you do have dry eye and severe dry eye, which I am very well aware that many of the patients who watch this channel, many of the folks that watch this channel do so because of severe dry eye, well, this is one of those medications that's a little bit outside the box, a little bit weird. And if your doctor's telling you about Acthar for dry eye, that means that they're very, very progressive and they're doing things a little bit differently. It is a short course in the eye world. It's just a 2 to 3 month span of Acthar. We're not looking to have you on it typically long term. We're just looking to break that inflammatory cycle, get you a little bit better, continue with your other in-office treatments and therapies, and just really break that cycle and start getting you feeling better. And so if this is something being suggested to you, just don't be afraid of everything I just said about these long-term effects. It certainly can do all of those things, and you have to be very careful. You want to be monitored, but we use lower doses in eye care, and we're using it typically for a very short pulse duration of time, just several months. It can be extended beyond that, but usually then we're taking that dosage down from twice a week, taking the medication down to once a week just to keep you under control. So if you have any questions about Acthar, definitely leave those in the comments below. If this is something you've tried for your dry eye, please, please, please share your experience down below, because this is not something that's being used very commonly in dry eye. So I would love to have your experiences. Or if you used it for something else longer term, certainly welcome to share those experiences as well. So that is going to be it for today's video. I hope you enjoyed it. It's a little something different, and I hope that you'll stick around, hit that subscribe button, because that is going to be it for today's iSchool. Class is dismissed.